Hi, this is Pamela Goodman. I'm the president and CEO of Ruthless Florida, and I want to thank all of you for joining us today for our very first Wednesday Women of Wisdom. Probably most of you are like us who are sitting at home and have been sitting at home or working at home for this last week. And thinking about how do we stay connected, how do we keep educated, how do we keep informed, and how do we keep really the support and the sisterhood and brotherhood that Ruthless has been developing over the last couple of years. So we are extremely fortunate not only to have unbelievably talented candidates and elected officials that come through Ruthless, but also our leadership and our executive board and in our staff and our supporters and our donors all around the state of Florida. And many of them happen to be real boots on the ground experts in this issue with the virus that we're dealing with now from very different facets of life. A lot of the things that we're seeing and that we're reading in our social media posts are factual, but probably the most of them are not factual based. It's hard to really separate fact from fiction. So what we thought would be important and helpful for our Ruthless community out there is to provide you with wisdom from women leadership throughout the state that are associated with the organization involving different facets of this crisis that has hit both our state and our country and the world, and hopefully gain some input. I'll let you know that we are recording this, and this will be released to all of our attendees. I think we have about over 150 right now online, which is terrific. We'll post this on our website. This is purely a public service announcement that Ruthless is producing, but I do want to put a disclaimer on this. This is an issue that clearly is changing every day, and I think each one of the women you're going to hear from their own touchstones will say that they're dealing with different facts, different information, and more information every day. So we can't promise that 100% of what is being issued this morning to you, and will be issued to you this afternoon via recording, is not going to be somewhat different tomorrow, but sitting here today at 10 o'clock in the morning on this Wednesday, the 18th of March, we have some of the best and the brightest, we believe, women leading on this issue. So just to give you a brief overview of who is on this panel today, Dr. Kayser Enneking. She is a lifelong resident of Gainesville, and she is an anesthesiologist at the University of Florida. She really is a national thought leader and innovator in anesthesiology, and she has extensive leadership in the University of Florida health system. Her commitment is improving the quality and access of healthcare. And that motivation and knowledge and wisdom has led her to be running currently for the Florida House District 21 seat. Joining her is Karla Hernández-Mats. She is a parent of 2 elementary age children. She is a special education middle school science teacher, and she is the president of the United Teachers of Dade in Miami, which is the largest teachers union in the southeastern part of this country. Besides being a board member of Ruthless, she is also a board member of the Florida FAL-CIO, and she chairs the Women's Rights Committee for the American Federation of Teachers. She'll be approaching this issue from a multi-point of view as a parent and a teacher and a leader in the education system. We also are happily joined by another Ruthless board member, the Honorable Alex Sink. She is the former elected Chief Financial Officer of the state of Florida, and she's the founder of Ruthless Florida. Prior to her public service, she had an extensive business background, 26-year career at the Bank of America, where she served as president of the Florida Bank, the largest bank in the state of Florida. She is committed and has been committed throughout her whole life to electing more pro-choice Democratic women to all levels of state government, both local and national. And we welcome Honorable Sink. And last but certainly not least, we welcome Barbara Zdravecky, who also is a member of our Ruthless Executive Board. Barbara is a seasoned healthcare executive from many points of view. She is a community activist that has focused on the rights of women, especially children and the disenfranchised, really throughout her entire life. She most recently spent the last 24 years as the CEO of Planned Parenthood of Southwest and Central Florida, and she has been active in many local, state, and national progressive politics and very many leadership posts. She'll be talking about self-care and from a mental health point of view, what we all can be doing and what we can be doing to help support those that are nearest and dearest to us. And with that, it's my pleasure to turn it over to Dr. Enneking to kick this off. Kayser?
Well, thanks, Pam. I really appreciate the nice introduction, and I appreciate the opportunity to be able to give people some very practical information about this pandemic that we're facing. But I want to emphasize, like you did, that this is a very fast-moving, evolving story, and this is truly a novel disease, and so we don't have all the answers quite yet. If we could move the slide forward. So in Florida, we are unfortunately particularly unprepared for a pandemic on this day. Can you move the slide forward? The first reason why we are having trouble and struggling with this is that we are one of only 13 states that hasn't expanded Medicaid. That means that we have almost 1 million people who are either uninsured or unable to obtain any kind of insurance in our state. And not having this kind of access to healthcare has created a population that really has no opportunity to have their health problems addressed during this pandemic. Next slide, please. The lack of Medicaid expansion has led to a crisis in our rural hospital system. You can see from this slide and the overlay that it has with the Medicaid expansion slide, in states that haven't expanded Medicaid, we have seen 77% of the rural hospital closures in those states. And that includes here in Florida, where we've had a number of our rural hospitals close. And what happens then is that people have to congregate their healthcare more. And so all of our facilities become inundated and people aren't able to get care in their own communities. Next slide. Florida also has a population that is skewed towards the elderly population. And with this particular virus, that seems to be a very important part of who is, sorry about that, who is at risk for this disease. Next slide. And finally, a very important part of this. In Florida, many in the medical community have known for quite some time that our county health departments have been underfunded. Not only have we seen our state have the highest increase in AIDS-related new diagnoses, but we've also just this past year been dealing with a hepatitis A outbreak. So public health has more to do with just health promotion and environmental health. Public health really is our front line in dealing with any kind of outbreaks, particularly with emergency preparedness, communicating that. And because our public health system, like many around the country, has been so underfunded in the last 10 years, we are woefully unprepared to deal with something like this pandemic that the COVID-19 virus has caused. Next slide, please. So let's move to COVID-19. This is a novel disease. Next slide, please. It's a novel disease that, first we had our first case here in the United States only at the end of January. And since that time, we know that we have community spread throughout the country. The problem with COVID-19 is that many people experience very mild symptoms. Most children will have no symptoms. as you move into middle age. The symptoms tend to be much worse, but in general, 90% of the patients that get COVID-19 will experience a fever. This doesn't have to be a fever of magnificent proportions. A fever of anything over 100 is likely to be one of the main symptoms of COVID-19. In addition, you get a deep, dry cough. So this is not just a little clear my throat sort of cough. This is a deep cough that's not terribly productive, but can leave you feeling actually short of breath. And shortness of breath is probably the most concerning symptom that you have. And so if you have this progressive fever, cough, malaise, and myalgias, which is where you get that achy kind of fluey feeling, it is likely that you have encountered a COVID-19. Now, we are in the height of allergy season here in Florida, and there's thick pollen everywhere. And so some people are having trouble sort of telling the difference between a runny nose and a scratchy throat and what may be COVID-19. So remember, 90% of the patients with COVID-19 will experience fever. The cough is not your usual cough that you might have had last spring, but it's a cough that is deep in your chest and is not terribly productive. If you feel like you're having these symptoms and you want to see a doctor, it's really, really important that before you show up at your doctor's office, you call and you let them know about your symptoms and you ask what they would like you to do. Many doctors are triaging their patients to different locations. If you don't have a primary care doctor, it's completely appropriate for you to be calling the COVID-19 Florida Department of Health call center. That number is available 24/7 and is on the screen right now. But please don't just show up to the ER. Don't just show up to your doctor's office. We want to make sure that you don't go there and then infect everybody else who might be either in the ER or at the doctor's office. And we particularly want to make sure that as many of our healthcare providers stay healthy during this time of need. Next slide. So, how do we protect people? Well, the answer is that everybody needs to be practicing social distancing. So social distancing is keeping a 6-foot radius around yourself, and it's really important that everybody be practicing these. So as I've said, missing a night or 6 at the bar is way better than coming home and giving your grandmother a kiss and having her get sick after you have come into contact with this virus. There are some people, though, who are particularly at risk of this. Anybody over 70, the CDC has now made the recommendation that any group of 10 or more people you shouldn't participate in that. This number has been fluid. When we first started with this, it was 250. It then became 50. It's now down to 10. And if you live in San Francisco, the recommendation is that you not even go out. We haven't been told that yet here in Florida, but it wouldn't surprise me if we had to go to that. Next slide, please. Now, there's a difference between self-distancing and self-isolation. People who, because we have a lack of testing, or we have up to this point in time, we have tried to get people to self-isolate if they're in a high-risk group. So that's basically anybody who's over 70, anybody who's in any immunocompromised position. So that's people who are on biologic medicines for a chronic medical condition. It might be somebody who has cancer that's getting chemotherapy or radiation therapy. It's those patients that we know who are particular risk because they have heart disease, they have diabetes, or they have lung disease. Again, because we have had limit in testing, we've asked people to self-isolate if they have been on any international travels, if they've been on a cruise ship, anybody with a fever, and anybody with close exposure to a person with a fever. Now, again, this might change as testing becomes more available, but to date, this is where we are. Next slide, please. So what we're trying to do with this social distancing and this self-isolation is really flatten the curve of who gets this virus. And the reason we need to flatten the curve is because healthcare systems can rapidly and will rapidly get overwhelmed if we don't take these types of protective measures. When the healthcare system gets overwhelmed, it means that people don't get the healthcare that they need. And this is so important for us to understand, because this is what's driving all these changes that we're being asked to do in America today. If we overwhelm our healthcare system, we will not be able to provide enough healthcare to keep everybody alive who gets COVID-19. I can't emphasize this enough. If we overwhelm our healthcare system, we will be in dire straits. We have seen this in China already. We've seen this in Italy. Both China and Italy have very sophisticated medical systems, and yet they have not been able to deal with the huge numbers of patients they've had, because this virus was rapidly disseminated through the population, and it just overwhelmed the system. Next slide, please. So, how can we flatten this curve? Well, you've heard this already. Social distancing is one, self-isolation and quarantine, but there's two other things. One is hand washing, and one is to make sure you don't touch your face. Now, that's a really hard habit to break, but part of Buddhism is be aware of where your hands are. So please take this time to meditate on where your hands are and don't touch your face. So, next slide, please. I have a great little video here that I found on the New York Times. And it was, do you want to turn the video on?